5 prominent scientists, including one from South Africa, are receiving a special UNESCO Women in Science Award at a ceremony in Paris tonight. Professor Quarraisha Abdool Karim from Durban is being recognized for her groundbreaking work tackling HIV across Africa. Widely respected, she is a member of the Academy of Science of South Africa and the African Academy of Sciences. A clinical trial led by her in 2007 was the first to show that a topical gel could reduce a person's risk of contracting HIV. Our correspondent in Paris, Whitehead, spoke to Professor Quarraisha and started by asking her about her work.
I'm an infectious diseases epidemiologist and I've been doing HIV/AIDS research since 1989. And one of the very first studies that I did was a population-based survey in northern KwaZulu-Natal. This survey highlighted for me two important aspects of the emerging and evolving epidemic. So even at this very early stage of the epidemic, we found that women had 4 times more infection than men, and women also acquired HIV 5 to 7 years earlier than men. So the important thing about the CAPRISA 004 trial was that it was the first study to show that antiretrovirals used by uninfected people could prevent sexual acquisition of HIV.
Now, being a scientist in and from South Africa and HIV being such an issue on the continent, how has that driven your field of work?
Absolutely. So if we look at the global statistics in terms of HIV infection, we've made enormous progress. You know, about 50% of the 37 million people living with HIV have access to antiretroviral treatment. We've seen a transformation from an inevitably fatal condition to one that's chronic and manageable. In terms of preventing mother-to-child transmission, in South Africa alone, we've gone in 2009 from transmission rates of 30 to 40% to less than 2%. But where we're failing is in terms of preventing sexual transmission of HIV. 2 out of 3 of the 5,600 new infections that take place globally each day take place in sub-Saharan Africa, and most of those are in southern and eastern Africa, and 1 out of 3 of those infections are in young women. So young women are central, adolescent girls and young women. If we are going to win the war on AIDS, we cannot ignore this important group of the population.
Well, congratulations on winning this award. Tell us how you felt when you discovered the news.
So the UNESCO Laureate Award is a really significant award recognizing women scientists. So to date, 92 eminent scientists have been recipients of this award across the 5 regions of the world. And so I was really thrilled, honored, and an absolute privilege to learn that I'm joining the ranks of these eminent scientists.
Now, of course, these awards celebrate and recognise the achievements of women in the field of science. Are there enough women in science, or does more work need to be done to increase the number?
So I think what we see, particularly in the biomedical and health sphere, in fact we have more women scientists than we do have male scientists. I think where the gaps come in is at a leadership level, and we see that still largely being male dominated. The importance of having women at leadership positions mean you set the science agenda. And women setting the science agenda means that half the population doesn't get left behind.
It's a substantial prize pot which the winners receive. How are you going to spend the money?
So what I propose to do is to use 20% of the money to set up a fund together with an international organization that recognizes women's science leadership in developing countries. And the rest of the money will be used towards research. We never ever have enough money for all the work that needs to be done.